Next up, it's been 3 years, nearly to the day, since the World Health Organization first declared COVID-19 a global pandemic. In the years since, we've witnessed immeasurable loss, as more than 6 million people around the world have died, along with an astounding innovation as well, as scientists race to develop vaccines, which have reached billions of people and no doubt saved countless lives. These days, much of the world has returned to a version of pre-pandemic normal, heading back in person to work and school, restaurants, concerts, etc., with many leaders, including President Joe Biden, declaring the pandemic essentially over. But hundreds of people are still dying of COVID every day in the U.S. alone, and millions are living with long-term symptoms after they've stopped testing positive for the virus. To look back at the last 3 years of COVID and the lessons we should take with us into the next few years, I'm joined by Dr. Cassandra Pierre, Medical Director of Public Health and Programs at Boston Medical Center, and Dr. Paul Sachs, Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital. Dr. Cassandra Pierre and Dr. Paul Sachs, thank you so much for joining us.
Great to be here.
Thank you for inviting us. Yes, 3 years have gone by very quickly, that's for sure.
You know, it's funny you say that because I was thinking it's been a long 3 years. I feel like somehow it's both seem to be true. You know, when I look back at what those early days were like, it's sort of an amazing thing to think about. And I'm wondering what your experiences were like in the beginning as everything changed virtually overnight. Starting with you, Dr. Pierre, can you just sort of remind us, for you, what things were like and what things were like in your hospital?
Absolutely, and I agree that time was elastic and both feels like a second and 10 decades have passed by. Yeah. It was chaotic, predictably. It was also clarifying. I felt like I was connected to my purpose, which is to prevent infections. And so it was a series of, long meetings coming together with our department or section or hospital to figure out what we needed to do to get the right PPE, to protect our patients, and figure out how to do what we needed to do to take care of our community.
Dr. Sachs, what was it like for you in those early days?
Yeah, I agree entirely, but I also say it was heartbreaking too. I think one of the really difficult parts about it were seeing people in the hospital who couldn't be visited by their family and friends. It's something that will always stick with me, the sense of isolation that the people with COVID-19 in the hospital at that time had. And it was, as I said, heartbreaking and something I hope we never have to go back to.
I mean, things got pretty bleak here in Massachusetts, as they did around the country, around the world. For each of you, what were the darkest days? When was it at its worst, and what was that like? Dr. Pierre, for you, what do you remember from those toughest moments?
There's a series of low points, but I think one of the things that really stuck out to me is that one of the first few patients, a series of first few patients, were pregnant women. And certainly have visuals of women remaining in ICUs long after their babies were born, weeks to maybe even months. And that was terrible. And to the extent that we could have anticipated anything, nothing that we anticipated. Also seeing young and previously healthy people dying. So I would say probably earliest in the pandemic when the confusion was highest and the tragedy was also really just palpable. And within our lives as well.
Dr. Sachs, what were those toughest moments for you?
Well, part of it was figuring out really how to move forward. I'm married to a primary care pediatrician, and her practice had to shut down, which is very unusual for pediatricians. Meanwhile, I was going into the hospital each day and not really knowing how to best manage the patients was very hard. People were looking to infectious disease specialists for answers, but we, of course, didn't have any at the time. It was a very difficult time. I think all of us have some degree of post-traumatic stress disorder related to it. And one thing that has been good is the coming together of the infectious disease community really to support each other during that period.
Yeah. We're at a very different time now. I mean, it's important to remember that COVID is not done, right? We're not done with COVID-19. But things feel very different right now. And a lot's changed. I'm wondering if you could speak to some of the things that have changed over the last 3 years. I mean, there's testing and therapeutics and vaccination. What are some of to you, the most significant changes that have happened, and how is really the world different now than it was 3 years ago this day? Dr. Pierre?
I don't think we can underscore the importance of vaccines. And of course, there's other factors like a collective infection-derived immunity, but really vaccines was our first light of hope in this. And so I really can't underscore it. Currently, I would say, though, for people who remain at high risk for severe complications, I think one of the things that brings me the greatest satisfaction is talking through with my patients or others a plan. What is going to be their therapeutic plan? What is the treatment that exists? And for some people, that light hasn't even gone off. The thought that they can prepare for what the worst might be if they remain medically vulnerable. So that's been incredibly gratifying.
One of the things I wanted to ask you both about is the fact that, for people who lost someone to the pandemic, clearly, life will never be the same. But also for people who did get the virus, a lot of them continue to have symptoms. There was a study in the U.S. In the publication Nature Communications from data from the U.S. Department of Veterans Affairs that said that COVID patients were 36% more likely to have long-term gastrointestinal problems than they did before the infection. 9,605 of them experiencing issues affecting the digestive system, intestines, pancreas, or liver. That was out of 154,000 patients who were studied. Are you seeing these long-lasting symptoms? And it seems like there's still just so much we don't know about long COVID. Dr. Sachs?
Well, absolutely. And one thing that is clear is that the people most likely to get long COVID, especially debilitating long COVID, are those who have the most severe initial infection. And those severe initial infections occurred predominantly in 2000 and 2001. So that created a whole population of people who really don't feel healthy at all, even though they've completely recovered from COVID-19. And one of the things that's really an important research agenda is how to manage people with persistent symptoms after they've recovered from COVID, because we still don't have a good approach to that. I will say on the bright side is that while long COVID still does happen with COVID-19 that occurs more recently, it's less common, and that's because the disease is less severe than it once was. Combination of vaccines and our infection-induced immunity has made COVID-19 a less threatening disease than it was, thank goodness, in 2020 and 2021.
Dr. Pierre, what would you say are the lessons that we learned over the last 3 years?
Well, there have been a lot. From where I sit, one of the more important ones is our community is key. I don't think we would have been where we were in our neighborhood and the communities that we serve without our community leaders, without having invested in ensuring that our messaging, our resources, our vaccines the science behind it was translated, the necessity was translated linguistically and culturally to the community at large. It was incredibly important to have them there. And so I think I would say that you worry about so many things slipping away, but that is one that I see enduring. We are really trying to center community in everything that we do, with the understanding that really any health outcomes we hope to have need to have individuals with the trust of the community behind them.
Dr. Sachs, what would you say the lessons are that we didn't learn over the last 3 years that we should have?
Lessons we didn't learn. Well,
Yeah.
one thing is that we really should understand that progress in science is a process. It's not like a light going on in a dark room. And we learn things incrementally. And so it is true that there might be revisions to recommendations. For example, the recommendations about vaccines, about masks, about whether to take drugs like Paxlovid, they might change as we learn more as we go along. And this doesn't mean that we're trying to mislead people. It just means that the science has changed. The data have given us an updated view. And I'm going to give an example right now. The treatment Paxlovid, which is very effective at helping keep people out of the hospital with COVID-19, is still very important for people who are vulnerable to severe COVID, and that be the older people or people who are immunocompromised. But it doesn't mean that everyone has to take it. And so right now, there really isn't a lot of evidence for giving it to young, healthy people. But that might change if we learn more about antiviral therapy and its potential benefits. So stay tuned and realize that science can be revised.
Okay. Dr. Pierre, are there other lessons that you wish we had learned that we haven't yet?
Oh, sure, absolutely. One big one is that we've talked so much about racial and ethnic health inequities, but I feel like with every emerging infectious disease or disease, we still remain surprised to see these gaps in health outcomes. And so although we've talked the talk, we haven't really made a point with each emerging new infection to center how information is shared, how underlying health beliefs and communication channels can impact the health outcomes in Black and Brown communities that have been systemically marginalized. So I think that's a big one, and one that really we have to do a lot more work on.
Okay. Dr. Sachs, what can we look forward to here, both in terms of COVID and other infections? I know that right now antibiotic-resistant Shigella is a concern that's starting to spread. What do you expect to see going forward?
Well, one thing that I want to underscore is that the research on treating COVID isn't done, and recently heard a very interesting clinical trial on treatment of COVID with another antiviral, not Paxlovid, but one very much like it, which showed pretty convincingly that if you then interviewed people who got that treatment 3 and 6 months later, they had a lower risk of developing the symptoms of long COVID. So that's the kind of progress I look forward to. As far as other things like antibiotic resistance, I just want to put a pitch in for our specialty. For those doctors out there who are wondering what to do, this is in a very exciting field. It is never boring. I can't say that either one of us has been bored a single moment in the last 3 years. And I'm pretty sure that's going to be true for the rest of my career.
I expect it will be. Dr. Paul Sachs and Dr. Cassandra Pierre, thank you both so much for joining us.
Thanks for inviting us.
Thank you.